This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU Webinar Series. Today's topic is recovering from a heart attack. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous. All right, I'm going to hand it off to you, Stephen, and you should be able to share your screen and start the presentation.
Okay, cool. Thank you, Jonathan. Let me share my screen with everybody. All right, so I think you should be seeing what I'm seeing, right? Everybody, did it look okay?
Yep, you're good to go.
Okay, so my name is Stephen Bove. I'm a lead physical therapist here at Mather Hospital. I work in the cardiac rehab center here. We're a newer program. We opened in November, started taking patients around the week of Thanksgiving. A little bit of my background. So I graduated with my doctorate in physical therapy from Stony Brook in 2017. Worked at Mather briefly in the ICU, and then worked out at Peconic Bay Medical Center in Riverhead for about 5 years. Helped them start up a pulmonary rehab and also worked in their cardiac rehab out there. So I'm going to talk to you guys a little bit today about recovering from a heart attack. So today's agenda, we'll talk a little bit about some common discharge instructions, things you might hear from the nursing staff and the doctors from a very general standpoint after you've had a heart attack, and gives you a better idea of what you might be able to look forward to in the coming days and weeks after that. We'll touch on return to physical activity. I'll talk in detail about cardiac rehab, what it is, what we provide, and how that could help you along your journey. And then we'll talk a little bit about support groups and beyond. I have a slide on different support groups at both the national and the local level, as well as touch on some mental health topics related to cardiac health. So first part is the first steps in your recovery, right? So after a major cardiac event, the nursing team and the doctors, everyone who took care of you will go over your discharge instructions. Those will be specific to your case. So in the next few slides, I'll talk about different variations of that. Again, those are general guidelines of what's commonly seen. Anything specific to your case would be discussed with you before discharge from the hospital. Any restrictions or limitations in activity would be on a case-by-case basis. It would also largely depend on what procedure you had performed. So if you had a heart attack and they just treated it medically without going to the cath lab, you may have one set of instructions. If you go to the cath lab and you have a stent placed, you might have a different set of instructions. And then if you wind up needing a bypass or open heart surgery, you'll have different instructions. So we'll touch on those topics individually, and then we'll kind of work from there. So what if I had a stent placed? The team will go over your instructions right before you go, but these are actually taken right from the discharge instructions they give the patients here at Mather after the cath lab. So they'll tell you no lifting or pushing with that procedure on for about 2 weeks, no driving for 24 hours post-procedure. They'll say that after 24 hours, you typically can shower, but they want you to avoid swimming or submerging that wrist or the site for about 1 week. And then you're going to be checking that site where they put the catheter in, looking for swelling, bleeding, changing color or temperatures. So swelling, changing color or temperature can be indications of infection. So that's why we're looking for those. And then they want you to look for bleeding because they do go into an artery to access your heart. So they want to make sure that there's no hematomas or blood pooling forming from where the catheter was inserted into the artery. Again, swimming and submersion, that kind of makes sense along the whole infection prevention standpoint. So we're trying to make sure that that incision heals up quickly and safely without any adverse effects. What if I had an open heart surgery? So open heart surgeries are obviously more invasive. They're also known as a CABG or a coronary artery bypass graft procedure. The medical team will go over limitations and what you can or cannot do before you leave. It is more invasive in the sense that it requires cutting through your sternum or your chest bone to access your heart. Obviously, when they're done, they wire your sternum back together, during which point the bones need to heal and reform. Traditionally, bones take 6 to 8 weeks to heal. Sternal precautions, we call them, last for about 3 months or 12 weeks. Those include no lifting more than 5 to 10 pounds, no reaching behind the back, and no pushing or pulling with the arms. That's all based on the fact that your pec muscles, so those all attached to your sternum. So we don't want to be activating those pec muscles too vigorously while those bones are trying to heal themselves, because those muscles are pulling on those bones that are trying to heal. So aside from that, we're also looking at wound care. Again, you'll obviously have a larger incision down your mid-chest as opposed to just a small incision on your wrist. The signs we're looking for are about the same. So we're looking for redness, swelling, warmth, or any kind of different discharge. Really any sign that there could be infection. When you go home and you have follow-ups with your home care nurses, and then if you eventually go to cardiac rehab, everyone will be checking that incision until it completely scabs over and closes up, just to make sure that there's no issues as far as infection is concerned. I really like this. It's a 2-page flow sheet that the American Heart Association has on their website. So I pulled it out and put it up here for you guys. It's kind of a way to track all your appointments, your medications, your vital signs, and it guides you on what to do after a heart attack. So if you ever needed it, I hope you don't, but if you ever did need it, it is on their website. It's called Life After a Heart Attack. So at the top here, you put your name. You can put your cardiologist or your surgeon up here with the phone number that you can reach them on. And then any notes from your nurse around the time of your discharge, like we spoke about in the previous slides. No lifting, no pushing or pulling, things like that. So you can throw those notes up for yourself just as a reminder. You can highlight them or make them stand out however which way you think is fit. The next part will be following up a schedule, follow up with your doctor. So again, you can put that doctor's name here. You can put the date of your appointment and the time that appointment's at and the address and where you're going. Just as a quick reminder at the top to check in. We'll talk a lot more in detail about cardiac rehab in the next couple slides after this. But there's a lot of good evidence in the rehab world, the nursing world, and cardiology on the benefits of cardiac rehab. It improves long-term outcomes, decreases mortality risk. It's really a well-enclosed exercise and education program that you would qualify for in the event that you do have a heart attack. So they have lines here for the same thing. So you can put the clinic name, the website, the address, the phone number. And then on the side, you could put, if you make an appointment, when that's for. Traditionally, I've seen patients coming out of the cath lab who've had a heart attack and a stent placed, 10 days out, where we could start doing their evaluations. So by the time everything's up and running and we're ready to start exercising a little bit more intensely, we're about at that 2-week mark. So those restrictions we talked about, pushing or pulling with the arm for 2 weeks, have kind of passed. The next section down here talks about your medications. So more than likely, after having a heart attack, your medications are going to change. You'll be placed on likely blood thinners, and you may be on blood pressure medication and medications to keep your heart rate at a normal rate. So they can get very confusing. The dose changes, when you should take it, what it's for, what kind of side effects they each carry. This is a nice little table that could help you sort that out. So you could list your name, the name of the medication here, what the dose is, how often do you take it. You could put AM or PM, AM or PM. What is it for? I feel like that's really important. A lot of people take medications that are prescribed, but they don't really know what it does or why it's important. So talking with your healthcare team is very vital as far as understanding what the medication's purpose is. I find that helps compliance, because people will be likely more compliant to take a medication they know the purpose of, rather than taking it because the doctor said to take it. And then side effects. So certain medications like statins can cause cramping. So listing potential side effects here would be really valuable. So if certain things start happening, you can have a talk with your nurse or your healthcare team about possibly switching medications, or they may have to adjust dosage if side effects are becoming a problem. Cool. So this is the second page of that life after a heart attack from the American Heart Association. This is tracking your numbers. We do a ton of it here in cardiac rehab, but this you can do at home. I would recommend getting a blood pressure machine if you don't already have one. They're pretty cheap. You can get one on Amazon or CVS, or they sell them pretty much everywhere at this point. But you should have an idea of what your blood pressure runs typically at rest, because a lot of the medications that you may wind up taking are dependent on those values. So this just talks about the date you take it at, the time you took it at, whether you take it in the morning or at night could make a difference depending on when you take your medications. Your heart rate. So I'm going to talk a little bit about how to check your heart rate manually. Other than that, there's all sorts of smart watches these days that can do that for you. But I do want you to have a good understanding of how to know if the number those devices are giving you are accurate or not. And then here there's a spot for AM blood pressure and or PM blood pressure. Once we get past that, the next part is to start moving, right? So my goal here in cardiac rehab and the goal of your team is to help you get back to doing things that you enjoy, getting back to golf or walking or swimming or whatever social task you enjoy. It could be something as simple as walking to your mailbox and back in the morning. It could be as complex as running a marathon. I've treated both triathletes in cardiac rehab, folks who are wheelchair bound, and everything in between. So there really is no limitation to how we can help. If you do wind up walking, this is a nice little way to track it. Date, time, what you did, how far you walked, and any notes. If you were here, you would want to put anything like, if it was hilly, the weather, if you were out of breath, how difficult it was for you. You can rate it like on a 0 to 10 scale, where 0 is doing nothing and 10 is the most intense exertion that you've ever done. Because then it allows you to track your progress, right? So goals are a lot more likely to be achieved when you can track progress, as opposed to when you're kind of shooting in the dark. And that's a nice table you could do that with. The next step down here is choosing good nutrition. So I think there are a lot of nutrition topics that are going to get covered this week, so I didn't go too much into them. But there is a good little blurb down here talking about how getting active, losing weight can naturally lower blood pressure and cholesterol levels. The American Heart emphasizes a dietary pattern that's high in fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, and non-tropical vegetable oils. So again, each section has a little link. So if you ever wanted to know more about it, you can put that into the computer. And heart.org is the website for American Heart Association. And then at the bottom here is find support. So there are wellness groups, there are mental health clinics, there are support groups, cardiac support groups in particular, all over the country. Supportnetwork.heart.org is a place you can find up or sign up for a list of those places. Otherwise, I'm going to talk a little bit more about that later on in the slides. So I see a question that's, when should we expect to begin cardiac rehab following the discharge from the hospital? It depends. If you just had a heart attack and or a stent placed, usually within 10 days or so. 10 days to 2 weeks is most typically when we get patients in to cardiac rehab. If the person had open heart surgery, sometimes it's a little bit longer, although some of the research in the rehab world is suggesting that earlier is better. It becomes a little bit more complicated with the open heart surgery because you're not allowed to drive for a little longer, so transportation becomes an issue. Also, from an insurance standpoint, most insurances won't cover home care and outpatient rehab at the same time. So if you are doing home care after discharge for wound care or whatever that might be, you would have to finish that first and then come to cardiac rehab. Hope that answered your question. So general exercise guidelines, the American College of Sports Medicine and pretty much everyone across the rehab world and exercise world has adopted the 150 minutes of moderate intensity exercise per week. What is moderate intensity exercise? But let's talk a little bit about it. Subjectively, you would describe it as an exercise that's light to somewhat hard, quote unquote. Yes, I will get to that. Let me round through and then I'll touch on that. I have it saved on the non-tropical oils. I have it saved on my list here. So subjectively, moderate intensity exercise is light to somewhat hard. It's some sort of exercise that does increase your respiratory rate. You feel like you're breathing a little bit heavier, but you can pass what's notoriously called the talk test. So you should be able to still carry a conversation while you're exercising. If you're working so hard that you cannot continue to have a conversation, then that would be more considered vigorous exercise. Right now, we're looking to stay in that moderate range, especially after a cardiac event. Couple ways from a vital sign standpoint, you can look at moderate intensity exercise. You can take your resting heart rate and add 20 to 30 beats per minute. That's a quick down and dirty way to kind of give yourself a target heart rate. We talked a little bit about manual pulse checking. If you're not familiar with how to check your pulse, we could talk about it now. There's a handful of ways you could do it. One is the carotid pulse. I'm not a fan of that when you're exercising, because when you do that, you're actually occluding your carotid artery for a little bit. If you have stenosis, that can make you lightheaded. The easiest way to do it is to take your index and middle finger of one hand, bring it to the thumb side of your wrist on the other side, on the other hand, and you should feel a little pulsating, like a thumping under your finger. Once you have that, you're going to set a timer and count how many beats you get over the course of a minute. So you're going to feel that pulse, and then you're going to count how many times you feel that over the course of 1 minute, and that would be your heart rate in beats per minute. If you have a regular heart rate, so that would mean you do not have atrial fibrillation or other sort of arrhythmia, you can cut that time down to say 15 seconds. So you can feel that pulse over the course of 15 seconds, multiply it by 4 and give yourself beats per minute, okay? Keep in mind, some of you folks might be on medications called beta blockers or other medications that suppress your heart rate or are intended to suppress your heart rate. In that case, you may not be able to achieve that 20 to 30 beats over your resting. In that situation, we're looking more at that subjective description, right? We want you working in that light to somewhat hard feeling, that slight to moderate breathlessness where you can still have a conversation. The little bit more aggressive way you can look at target heart rate. So this is more how I look at it in cardiac rehab. Given I have a little bit more about your background data, if we can be a little bit more aggressive, we can do 60 to 80% of 220 minus your age. So just for quick information, so I'm 31 years old. If you were to do my heart rate, my target heart rate, we would do 220 minus 31. That would give you a max heart rate of 189. So 60 to 80% of that would be my target range. That's where I'm looking to get my heart rate into to achieve a cardiovascular effect, okay? So if I did the math before this, so my lower end of the range would be about 113. The higher end of my range would be about 151. So if I were to go exercising, my goal would be to get my heart rate into that area of 113 to 150 for at least 30 minutes, 5 times a week, or collectively 150 minutes a week. Okay, that falls into the same guidelines though as the beta blockers and having suppressed heart rates due to medications. If you are on medications that suppress your heart rate, obviously that wouldn't work as a way to monitor your exercise intensity. how hard your body's working, then you should resort more towards that subjective description. So what are some reasons to stop exercise and call a doctor? New onset chest pain. Some folks have what we call stable angina, so they know, how much work they can do before this chest pain is induced. If that's the case, you want to work under that threshold. If you don't typically have chest pain and it comes on, that's a red flag to call a doctor, call an ambulance. Those are concerning signs. People who have that called stable angina, they usually carry a medication called nitroglycerin that they take that dilates arteries, helps to resolve that pain. So those that have had it kind of know how to deal with it. Lightheaded or dizziness on exertion, chest palpitations are two symptoms that you may feel. Those are reasons to stop exercise, call a doctor. And decreasing heart rate with increasing workload, right? So if you're doing more work and your heart rate is not responding, that might be a reason to call your doctor. In some instances, people are on a lot of beta blockers and medications to suppress the heart rate. So when they go to exert themselves, they're not getting an appropriate heart rate response. That can make them feel tired, lethargic, kind of sluggish. So those are reasons to stop and kind of reassess. So where do we start? Honestly, starting works the day you're in the hospital. They should have you up and walking in the hospital. Start slow and listen to your body. Start with achievable goals, right? So a lot of people ask me when they start doing home exercise programs, how do I know I've done too much? How do I know it's not enough? So not too much is a little bit easier to talk about, right? So if you're very sore the next day in your legs, your hips, you might have overdone it. When folks come for their first exercise sessions in cardiac rehab, I'll talk with them about post-exercise soreness, right? We're exerting your muscles in a way they haven't done or recently or may not have done typically. So it would not be unusual to expect soreness in your muscles, but it should not last more than 24 hours. So if you're experiencing soreness that lasts more than 24 hours, you might have done too much work and probably should take it easy and or back off the intensity for the next sessions. That doesn't mean you won't get back there again. That just means you have to start a little bit more conservatively and work your way up. Walking does help prevent a lot of postoperative complications. There's an exhaustive list, but this list on the PowerPoint is not exhaustive. Blood clots are the big one. Post-op ileus, so when you're immobile for long periods of time, your GI system can slow down, causing GI issues. And then physical deconditioning, right? So generally speaking, every day spent on complete bed rest, you lose 2 to 4% muscle mass, right? So you can imagine if you're in bed for a week, how much harder it is to get up and move around after that. The next piece of advice would be to set realistic goals, right? And increase a little bit each day. We talked in the previous slides that had the graphs in it from the American Heart Association about ways to track your exercise. If you have Apple Watches, Fitbits, Garmin's, whatever kind of smartwatch you have that tracks your steps, that's awesome. You can go off of that. You can go off of how long you're walking each day. So I mean, it's blizzarding outside right now, but when the spring comes around and you can get outside and walk a little bit, you might be able to walk a block and back, right? That might take you, 5 minutes. And then if you could do it in 4.5 minutes the next day or the next week, awesome. So you can take a set distance and gradually work your time down, increasing your speed. Or you can set for gradually longer and longer distances, and that could be anything from walking from your couch to the kitchen. That could be, running 10 miles. There's really no strict guideline on that, right? So we can titrate exercise to your current level of function and then work our way up from there. Easy sitting exercises you can do at home, and these might be like super basic and low level for some folks. They may be fairly tiresome and higher level for others, but they're a good place to start, just to start getting your legs moving, even when you're still in the hospital. Practicing sit to stand is a great activity. So you can literally take a chair and stand up 10 times in a row. It's essentially the same biomechanic form as a squat right? So you can just practice sitting up and down, and it's working your glutes and your quads the same way a squat would. Great way to improve your lower extremity strength without lifting weights, right? Especially if you have that weight restriction. Climbing steps is a similar idea, right? So you can go up and down your steps and work on your lower extremity strength. That'll also help your endurance, get your breathing going a little bit. Steps are a nice workout. On a little bit more simplified level, so you can use sitting exercises. I have pictures of all of them here. So the marching would be sitting, marching your knees up and down. You can also do this standing. So standing marching also works. Kicking or knee extensions are this middle picture, working on getting your quads activated. And then sitting, hip abduction and adduction is the medical term. So they're also called clamshells. So it's this bringing your knees together, separating them. The girl in the picture on the bottom right is using a resistance band. You don't need to do one with that. You can use your hands and put them on the outside of your knees and push out gently. You can take a ball or a pillow and put them between your knees and you can squeeze gently, right? So there are a lot of ways we can vary simple exercises. After that, cardiac rehab is a commonly prescribed option. And then beyond cardiac rehab, we'll talk about support groups and taking what you've learned out into the community. This is our flyer for cardiac rehab. Again, ours has been open for about 3 months now. Traditionally, it's a 12-week program. I'm not going to go into too much detail here because I'll talk more about the structure of cardiac rehab in coming slides. But the phone number at the bottom here is our phone number directly to the gym. You can always call and ask us questions. We're always available for you. If we don't answer on the weekend or at night, you can leave a voicemail. We'll call you back. Otherwise, you can log on to matherhospital.org/cardiac rehab, and you can find more information there. Qualifications for cardiac rehab are a little bit beyond just a heart attack. So this is a Medicare-specific list of diagnoses that qualify for cardiac rehab. Most private insurances will follow Medicare guidelines. Some might approve other diagnoses, but that's more of a case-by-case situation. So the first one would obviously be a heart attack. That heart attack would have had to happen within the last 12 months for Medicare to approve that. A valve repair or replacement would work. PCI or DES are just the medical abbreviations for a stent placement. A lot of times you might have that if you come into the hospital with a heart attack, they may put a stent in to open up arteries and allow adequate blood flow to further parts down in the heart. Stable angina I talked about a little bit earlier. That's angina is the medical term for chest pain, right? So stable angina or stable chest pain would mean a person who gets chest pain at a certain threshold, right? So there's no pain at rest, and we have a defined work intensity that brings on this chest pain, and then when that's stopped, that goes away. If you're ever having chest pain at rest, that's a flag, a red flag. That's a time to call an ambulance, a doctor, and get seen by a medical professional. A CABG or an open heart surgery, coronary artery bypass graft, that is another diagnosis that would qualify. Congestive heart failure qualifies. The tricky part about that is they only take systolic heart failure for cardiac rehab. So systolic, you have the atria, which is the top chambers of your heart, and the ventricles that are the bottom chambers of your heart. So your ejection fraction is how much blood your left ventricle ejects out to your body every time your heart beats. So if 100% is your left ventricle ejecting all of the blood, 35% would mean that only 35% of the blood that's filled in the left ventricle is being pumped out, right? And then heart and or lung transplant. Again, if you have private insurance and you're not sure, you could always call and we can look into that in more detail for you. So the structure of cardiac rehab, your evaluation is about an hour, sometimes closer to an hour and a half. During that point, you'll meet with a physical therapist and a registered nurse. We will go over your medications, make sure what you're taking is what you should be taking. We get all the records from the doctor before you come, so we can compare what you have to what they have and make sure that there's no discrepancies. We'll go over the event that occurred with you, talk about your medical history, and then talk about controllable aspects of your day-to-day life, your diet, things like that, that we can work on to help prevent this from happening again. We do what's called a 6-minute walk test. So we'll put you on a heart monitor. It's not on a treadmill. We'll have you walk in the hallway for 6 minutes while we monitor your heart rate and rhythm. And then we'll use that information to build your exercise program. It gives me, as a physical therapist, an idea of how your heart and your body responds to exercise. Also lets me know from a musculoskeletal standpoint, do you have arthritis in your knees or your hips, or things that might impede on the ability to perform certain exercises. Aside from your vital signs and how much work you're doing physically in the program, we use subjective outcome measures. One is called the Dartmouth. So that's a quality of life index. We do those at the beginning, the middle, and the end to see how your quality of life has changed, hopefully for the better. PHQ-9 I'll touch on again a little later. That's a depression screening. So there are higher rates of anxiety and depression after heart attacks and cardiac events. So we do want to screen for depression and then provide appropriate resources as we can. And then the picture of your plate is a diet survey. So obviously what you eat and how you eat can affect your diet. What you eat and how you eat can affect your heart and how you recover from a cardiac event. The main program is 36 treatment sessions. So you'd come just like outpatient therapy. It's 2 to 3 times a week for a total of 12 to 18 weeks. So 2 to 3 times a week, 12 to 18 weeks gets you to 36 sessions. The sessions are about an hour. We will monitor your telemetry. So we'll watch your heart rhythm and your rate while you exercise. We'll take your blood pressure, and then we'll provide education on your medications and all that good stuff. I will go into more detail in the next couple slides. That's our gym. So we're up in the medical arts building. We have an upright bike, a sitting stepper, an elliptical, some treadmills, and then back there we have hand and ankle weights. So again, I can make exercises as easy or difficult as you need. My goal is to get you working in that moderate intensity for about 30 minutes to 40 minutes a session. So a session in detail, you arrive for your rehab session, you'll hang up your coat, we'll put you on a telemetry monitor. Again, that allows the staff to monitor your heart rhythm and rate during exercise, and we'll take your resting blood pressure. If you're diabetic and you're on a long-acting medication like metformin, we won't necessarily check your blood sugars. But if you are diabetic and you're on a short-acting medication like insulin, we will check your blood sugar before you start just to make sure we don't drop too low. We don't really like you to start exercising lower than 100 because exercise will naturally make your blood sugars drop, which can be problematic if you drop below 100. If you're kind of borderline, we would we call it preload you with a snack or something to eat just to get your blood sugar up a little bit and make sure we don't bottom you out. Typically, the first exercise we'll do is some sort of cardiac warm-up, a cardio exercise. That could be walking, that could be on the treadmill, that could be on the sitting stepper. It's to get your muscles going, get your heart pumping, warm you up, so to speak, for the exercise. When you're done with that, that's usually like 15 to 20 minutes. When you're done with that, we'll take your blood pressure, we'll check your oxygen levels, and then we'll move on to the next exercise. Generally, sessions are 3 exercises. I like to do a cardio, some sort of resistance if we're able to, and then another cardio. That resistance training in the middle kind of breaks up the cardio a bit. So some folks have a hard time doing back-to-back either from a breathing standpoint or just from an endurance standpoint. So it almost acts like an active rest break. The resistance training would only be performed again if we're outside of that 12-week mark for open heart surgery or 2 weeks out for just the stent placements. The third exercise, usually another form of cardio, again, another 10-15 minutes. My goal for the whole session is to maintain your heart rate up. So I usually try to avoid having people sit for too long in between exercises, because if your exercise is going in and out of that target heart rate zone, it's not as beneficial as kind of keeping you in that moderate intensity zone for the 30 to 40 minutes consistently. Next part is we call it cool down. So you can do gentle walking, you can rest in the chair and just kind of do some sitting heel raises. We're just allowing your body to return to its resting state, right? So we expect your heart rate and your blood pressure to go up while you exercise, and then we expect it to come back down to resting or maybe a little bit lower than that post-exercise. So that cool down period kind of lets you come back to the resting state. We'll then get your final vital signs. which is blood pressure, oxygen levels, and if we're checking your sugars, we'll get that. And then the session is completed, so you can disconnect from the monitor. Anyone who's had an EKG done in the hospital, they stick 12 things on you. Not that bad. Here we only use a 3-lead monitor, so you're not getting stuck with 12 stickies on your chest every time. It's just 3. So what are our responsibilities while you're here, right? So we're going to monitor your rhythm and heart rate, make sure you're achieving the target heart rate we're looking for at least 30 minutes. We're monitoring for arrhythmias and ensuring your body has an appropriate response to exercise, right? So I spoke a little bit earlier about, a concerning sign that you're not tolerating exercises if your heart rate's decreasing with an increasing workload. That's something we would monitor for, or we monitor to make sure your blood pressure is going up while you exercise and not going down. So if that is the case, that can be a sign that the exercise intensity is too much for your heart to accommodate, and therefore we'd have to back off and kind of work our way up. That leads into us titrating your exercise, so we can adapt it intensity-wise, make it harder, make it easier from a cardiac standpoint. But in many cases, folks have low back pain, arthritis in their hips and knees, so we have to adjust exercises accordingly just to make everything comfortable, right? And then education. I have these strips here. Anyone who's familiar with cardiac strips, that's what's called normal sinus rhythm. That looks really nice and pretty. We're happy when it looks like that. So we give that the thumbs up. And then this is what we call VTAC, and that is like emergency, whole lot of medical professionals around you real quick. So that would be the thumbs down. So our goal is to keep you here and keep you away from that. So what topics do we cover? Medication uses, side effects, and management. Again, I really believe, and I have one of my nurses here, Rusty, who's here to help me answer questions once we get to the Q&A point. But I'm really a believer that patients who understand what their medications are used for are going to be more likely to be compliant with those medications rather than just taking it because someone told you to. Exercise prescription and modification. Pulse checking we talked about, target heart rate zones we talked about, reasons to stop exercise we talked about, and home exercise programs. So you're not with us in cardiac rehab forever, as much as I'd love to keep some people. Our goal is to help you understand what you need to know about your disease process, the event you had, and get you back to doing your things on your own. Cardiovascular disease and management, that would be more medical education about the event that happened, what a blood pressure means, what heart disease is, things like that. Stress management, we'll talk a little bit about, diabetic education, and nutritional counseling. That's the last part I touch on, nutritional counseling. So I'll just touch on that, the healthy oils we talked about a little bit. So the American Heart Association recommends oils that are quote unquote better for you and less than saturated fat. Those include canola oil, corn oil, olive oil, peanut, safflower, soybean, sunflower, and vegetable. So those are good oils to be using. So I have a big old picture of a toolbox with a bunch of tools in it. That is touching on the last slide where I mentioned that patients don't get to stay with us forever. So our goal while you're here and with these webinars is to give you the tools that you need to manage your symptoms, your heart health at home, right? So I talk to patients all the time in rehab, and as we get closer to the end of their program, we talk about it a little bit more in depth about, so when to stop exercising, what we're looking for, now what are you going to do at home to continue everything, right? So where are we taking it next? So we're giving you the proverbial tools for your toolbox to take out to the outside world and gyms and walking leisurely or whatever it is you plan to go back to doing. Tennis, pickleball's very popular now. So does it work? The AACVPR is the American Association of Cardiovascular and Pulmonary Rehab. They have a publication called The Evidence of Benefits of Cardiac Rehab. And that is a class 1 indication for these diagnoses. A class 1 indication means it has the highest level of evidence to support its efficacy. So it's a class 1 indication for heart attacks, stents, open heart surgeries, stable angina, and heart failure. Evidence suggests that cardiac rehab results in a decrease in all causes of mortality by 15 to 28%, a decrease in cardiac-related mortality by 26 to 31%, a decrease in recurrent cardiovascular event, decrease in hospital readmission rate, and there's a strong correlation between more sessions completed and better long-term outcomes. And that all kind of makes sense, right? So we talk about giving you the tools you need, the understanding you need to improve your overall health. That should decrease your risk of cardiac and other causes of mortality and decrease the recurrent cardiovascular event, right? If you're exercising, inherently that should help you lose weight as well as eating better. All those things are risk factors for cardiac events. So if we address all those issues, then the risk of those events should go down. And research has shown that it does. So what's next? We talked about the home exercise program. My goal is to increase your independence, right? And then we'll follow up with staff on a plan to continue post-cardiac rehab, right? Attend a gym, return to leisure activity, do what you enjoy. People are a lot less compliant with exercising when they're forced to do something they don't like. If the gym is not a place for you, then don't go to the gym, right? There are other ways we can get you exercising and get your heart rate up and bring activity. That could be as simple as going for a walk with your spouse around the park or on the block. That could be going for bike rides. I recently had someone, we were talking about a home exercise program. That person hated the gym, loves to ride her bike. I'm like, that's great. So, obviously not today, but let's get you back to bike riding. Go bike riding. I mean, we live in the North Shore of Long Island. There's hills everywhere, right? So bike riding is a fantastic way to exercise. So if you do what you enjoy and do it with a friend or a loved one, you're much more likely to be compliant going out and doing these things. And then on your last day, if you do go to cardiac rehab, we do what's called graduation. Traditionally, I've played pomp of circumstance, and we do a whole little graduation ceremony. The rehab is a nice place. You get a lot of camaraderie, patients who have gone through similar things, exercising together. It almost becomes a little bit of a support group, which oddly enough will lead us into our next topic. Beyond cardiac rehab, there are support groups all over the country. There are local support groups. At the national level, the American Heart Association is a wealth of knowledge and information. So I gave you a little breakdown here. So if you go to heart.org, then you go to health topics, and then you go to caregiver support, there's a whole page on support groups, education, blogs, videos, tons of topics that you can click on, and you really can spend a day on that page with resources on moving on past a heart attack or a cardiac event. Mendedhearts.org is another place you can do that, and womenheart.org is another place you can do that. So those are all fantastic resources, and they can point you in the right direction if you're looking for a support group or a mental health resource, things of that nature. Locally, Northwell has a support group. This is the phone number down here for the cardiac support groups in Northwell, 516-562-8410. And then Stony Brook also has one. It's 631-444-4000. So if you were looking to talk to someone about support groups or resources, that's also a great way to do it. Mental health. We can't talk enough about it, right? Mental health, and it's been more of a conversation in the media over the last couple of years, really since the pandemic. And I think that's for the better, because the more it's talked about, the more we can take care of it and address it. It's equally as important as physical health, especially when it comes to your recovery from our cardiac event. I have a picture of a young lady down here doing some relaxation techniques or deep breathing exercises. So if you were looking to do something like that, you would sit in a chair with your feet flat on the floor, your arms resting either on your lap or on the armrests, and then you would breathe in through your nose for 2 seconds, and then breathe out through your mouth for 4 seconds. And your focus is on the movement of air, right? So you're paying attention to where the air is going in and out. That will help relax you. It will lower your blood pressure. It should help lower your heart rate, especially if you're feeling anxious. Returning to community activities, that improves quality of life, right? So the more you get back to what's quote unquote normal for you, the less likely you are to feel down and sad about the event that happened. That's more or less why I like that quick transition from your event into some sort of exercise or rehab if that's where you go. Because I try and minimize the downtime. If you minimize the downtime, it's less of a time to process that, wow, I had a major event. It stops you from thinking about it too much, right? We're going to touch on it. We'll educate you about it, but it's not a real major pause in your life. It's like, yes, your event happened. Let's get you going again. I see a question just popped. How long is the wait list for Mather cardiac rehab? We don't have one. We have availability as early as, well, would have been today, but it's snowing. But we have availability as early as Thursday. The PHQ-9 I mentioned about earlier, that's a depression screening we perform in cardiac rehab. So it's 9 questions. It talks about how you felt in the last 2 weeks, right? So one of the questions is, are there days you felt down, depressed, or hopeless? Are there days you've been tired or had little energy? Are there days that you've had a poor appetite? And that gives us a score and an indication of if there is depression, how significant that is. And then if it is more of a moderate to severe level of depressive symptoms, then we can provide the resources and references accordingly. The British Heart Foundation looked into depression and anxiety after a heart attack specifically. They found that 15% had serious depressive symptoms, while another 25% on top of that had mild depressive and anxiety symptoms. So collectively, you figure almost 4 in 10 patients after a heart attack experienced some sort of depression and anxiety, which is all the more important that we're talking about it, providing resources, and helping to address that. The staff education on stress management I touched on a little bit earlier. And then mental health resources, more and more are coming out. NAMI is a big one. It's the National Alliance on Mental Illness. And then there is, excuse me, the Substance Abuse and Mental Health Services Administration. That's a federal website where they have resources to anything from substance abuse to mental health resources and everything in between. And then more recently, this number 988 became a thing. It's fantastic. It is more or less the 911 of a mental health emergency. So that is a number to keep and save if you ever have thoughts that you are feeling down, depressed, or hopeless. Those are some resources, or you go to the emergency room where they can provide that help. That's what I had prepared for you guys. If you didn't want to send a message in the chat or ask a question here, you could always email me. That is my email address. I check it regularly. I will open it up at that point to questions.
Awesome. Thank you so much, Stephen. And like you said, if anybody has any questions, you can put them down in the Q&A feature at the bottom of the screen. We'll give it a few moments here to see if anybody has anything.
Yeah, no problem. I think I did. And the person that asked about the oils, were you here for that answer? I can repeat it if you need. The non-tropical oils. Okay, perfect.
All right, that might be all the questions that we have. So I guess I'll close this out. Again, I just wanted to thank you, Stephen, for your very informative presentation. It was great. If you have any additional questions, you can either email Stephen or email us at matherhospital@northwell.edu. Once you exit the webinar, you'll see a brief survey. If you can complete that for us, that'd be great. We really appreciate your feedback on trying to improve our HealthyU webinars. And if you'd like to view past HealthyU webinars, you can see them at www.matherhospital.org/HealthyU. Thank you, everybody, so much. Thank you again, Stephen, and have a great day, everybody.